If you are over 60 and you wake up to pee 2, 3, or even 4 times a night, don't ignore it. In the next few minutes, I'll walk you through 7 evening habits that may help you sleep longer, reduce those bathroom trips, and understand what your body may be trying to tell you. Stay with me until the end, because the last habit is the one many seniors skip, and it can make the whole night safer. Maybe this sounds familiar. You finally fall asleep, then your eyes open at 1:30 in the morning. You feel that pressure in your bladder. You get up slowly, shuffle to the bathroom, come back to bed, and just when you start drifting off again, it happens one more time. By morning, you feel tired, foggy, and older than you really are. You're watching Dr. Wellness, where we explain simple health habits for seniors in plain English. If this kind of clear health explanation helps you, like this video, subscribe to Dr. Wellness, and comment below with how many times you wake up at night. Now, many people blame the bladder right away. They say, "My bladder is weak," or "This is just what happens after 60. But sometimes the bladder is not the whole problem. Think of your bladder like an alarm bell. When it rings at night, the bladder may be making noise, but the real reason could be somewhere else. It could be fluid sitting in your legs during the day, too much salt at dinner, drinking too late, poor sleep, certain medicines, prostate changes in men, pelvic floor weakness in women, or blood sugar issues. That does not mean you should panic, but it does mean you should pay attention. Waking once at night can be common with age. Waking many times every night, especially if it is new or getting worse, deserves a closer look. The first evening habit is to move your fluids earlier, not to stop drinking water. This is important. Many seniors here don't drink at night, and they become afraid of water. Then they drink too little during the day, get dehydrated, feel dizzy, become constipated, or feel weak. That is not the goal. Your body still needs fluid, but the timing matters. A simple habit is to drink more of your water in the morning and early afternoon. Then, in the last 2 to 3 hours before bed, take smaller sips instead of large glasses. If you need to take pills at night, use just enough water to swallow them safely. Do not dry yourself out. Just avoid loading the body with a big amount of fluid right before lying down. This helps because when you lie flat, your kidneys may make more urine. Your kidneys are the body's filters. During the day, gravity pulls fluid downward. At night, when you lie down, that fluid can move back into the bloodstream. Then the kidneys filter it and your bladder fills. So if you also drink a big mug of tea, water, or milk close to bedtime, you may be giving your bladder 2 jobs at once. Try this tonight. Notice your usual bedtime. About 3 hours before that time, make your last full drink. After that, use small sips only. If your mouth gets dry, rinse your mouth, take a sip, or ask your doctor if any medicine may be causing dry mouth. Some blood pressure medicines, allergy pills, mood medicines, and bladder medicines can make the mouth dry. The second evening habit is to check what is in your cup after dinner. This one surprises many people because the problem is not always how much you drink. Sometimes it is what you drink. Caffeine can irritate the bladder. It can also keep the brain more awake. Coffee is the obvious one, but tea, green tea, cola, chocolate drinks, and some energy drinks can also contain caffeine. Even if you say, "Caffeine does not bother me," your bladder may disagree. After 60, the body may clear caffeine more slowly. That means an afternoon or evening cup can still be active at night. Alcohol can also be a problem. A small drink may make you sleepy at first, but later it can break up sleep and increase urine production. It can also make walking to the bathroom more dangerous because balance may be worse in the dark. So the habit is simple. Keep caffeine earlier in the day and avoid alcohol close to bedtime if night urination is bothering you. Try a 7-night test. For 1 week, avoid caffeine after lunch and skip alcohol in the evening. Do not change everything else at once. Just observe. If your bathroom trips drop from 3 to 2 or from 2 to 1, you have learned something useful about your body. Stay with me, because the next habit has nothing to do with drinking, yet it can fill your bladder at night. The third evening habit is to reduce salty foods at dinner. Salt acts like a sponge inside the body. It helps the body hold on to water. When you eat a salty dinner, such as canned soup, deli meat, chips, pizza, salty sauces, pickles, fried takeout, or packaged meals, your body may hold extra fluid for a while. Later, when you lie down, that fluid can return to the blood and become urine. This is one reason some people say, "I barely drank anything, but I still woke up all night." The fluid may not have come from your bedtime glass. It may have been stored in the body after a salty day. This matters even more after 60 because blood vessels, kidneys, and hormones that control fluid balance can become less flexible. Some people also have high blood pressure, heart problems, kidney disease, or swollen ankles. Salt can make fluid problems worse for many of them. The habit is not to eat bland food forever. The habit is to make dinner less salty. Use herbs, lemon, garlic, onion, pepper, vinegar, or salt-free seasoning. If you eat packaged food, check the label. Choose lower sodium options when possible. If you enjoy soup, try a low-salt version. If you eat restaurant food, ask for sauces on the side. Also notice your ankles in the evening. Do your socks leave deep marks? Do your feet feel tight? Do your shoes feel smaller at night than in the morning? That can be a clue that fluid is pooling in the lower body. And that brings us to the next habit. The fourth evening habit is to help your legs return fluid before you go to bed. Many seniors do not connect swollen legs with waking up to pee, but the connection can be strong. Think of your legs like two soft sponges. During the day, especially if you sit for long hours, fluid can settle down into the legs and ankles. Then at night, when you lie flat, the body squeezes that sponge back into the bloodstream. Your kidneys filter the extra fluid, your bladder fills. Then you wake up. A safe habit is to elevate your legs earlier in the evening. Not while sleeping, unless your doctor has told you to do that, but before bed. Sit comfortably and raise your feet on a pillow or footrest for 20 to 30 minutes. Your feet should be supported. Do not strain your back. While sitting, gently point and flex your ankles. Make small circles with your feet. This helps your calf muscles pump fluid upward. Your calf muscles are sometimes called a second heart because they help push blood and fluid from the legs back toward the chest. When you sit still for hours, that pump slows down. Gentle movement wakes it up. Some people also use compression socks during the day, but do not start strong compression without asking your doctor, especially if you have poor circulation, diabetes, nerve problems, leg wounds, heart failure, or severe leg pain. Compression is not right for everyone, but simple leg elevation and gentle ankle movement are usually a safe place to begin for many people. Call your doctor quickly if you have sudden swelling in one leg, pain in the calf, redness, warmth, chest pain, or shortness of breath. Those can be signs of a serious problem and should not be treated as a bedtime habit. The fifth evening habit is to empty the bladder calmly, twice, before sleep. This is sometimes called double voiding. Voiding simply means peeing. It does not mean forcing. It means giving the bladder a second chance to empty. Here is how it works. About 20 to 30 minutes before bed, go to the bathroom. Sit or stand comfortably. Take your time. Do not push hard. Then continue your bedtime routine. Brush your teeth, wash your face, change clothes, prepare the bed. Right before you lie down, go one more time. Often a small amount comes out the second time. That small amount may be enough to give you a longer first stretch of sleep. This can help because some people do not fully empty the bladder the first time. In men, an enlarged prostate can slow the flow of urine. The prostate is a small gland near the tube that carries urine out of the body. As men age, it can grow and press on that tube. This can cause a weak stream, starting and stopping, dribbling, or feeling like the bladder is not empty. In women, pelvic floor changes after childbirth, menopause, surgery, or aging can affect bladder control. The pelvic floor is the group of muscles that support the bladder and bowel. When these muscles are too weak, too tight, or not coordinating well, bladder signals can become more troublesome. Double voiding is gentle, but straining is not good. Do not bear down hard. Do not sit for a long time trying to force urine out. If you often feel blocked, have pain, have a very weak stream, or cannot pee even when you feel full, call your doctor. The next habit is one many people do not think about until they check their medicine bottle. The sixth evening habit is to review the timing of your medicines with your doctor or pharmacist. Never stop a medicine on your own. Never change the dose by yourself. But do ask whether the timing could be affecting your sleep. Some medicines make you pee more. Water pills, also called diuretics, are a common example. They are often used for blood pressure, heart failure, or swelling. They help the body remove extra fluid. That can be very important. But if they are taken too late in the day, they may send you to the bathroom at night. Some diabetes medicines, some heart medicines, And even certain supplements can also affect urination, thirst, or sleep. Blood pressure patterns can matter too. This is why the safest habit is to bring a list of your medicines to your next appointment and ask one simple question. Could any of these be making me urinate more at night, and is the timing right for me? This question is especially important if your night urination started after a new medicine, a dose change, or a new supplement. Also tell your doctor if you feel very thirsty, have blurred vision, lose weight without trying, feel burning when you pee, or notice a great change in urine smell or color. Frequent urination can sometimes be linked with diabetes, urinary infection, kidney problems, or other conditions that need proper care. Do not feel embarrassed. Doctors hear this problem all the time. The more clearly you describe it, the easier it is to help. Say how many times you wake up, whether you pass a large amount or just a little, whether there is pain, whether you snore, and whether your legs swell by evening. That brings us to the 7th habit, and this one is not only about peeing less, it is about protecting your hips, your head, and your independence. The 7th evening habit is to make your nighttime bathroom trip safer and less stimulating. Even with the best habits, you may still wake up sometimes. The goal is to avoid turning one bathroom trip into a full hour awake, or worse, a fall. Before bed, clear the path from your bed to the bathroom. Remove loose rugs, shoes, cords, and clutter. Use a soft nightlight. Keep your glasses, cane, or walker within reach. Wear slippers with grip, not loose socks on a slippery floor. If the bathroom is far away, talk with family or a healthcare professional about safer options. When you wake up, do not jump out of bed quickly. Sit on the edge of the bed for a few seconds. Move your ankles. Let your body adjust. This matters because blood pressure can drop when you stand, especially after 60, or if you take blood pressure medicine. That sudden drop can make you dizzy. Also, keep the bathroom trip boring. Do not turn on bright lights if a nightlight is enough. Do not check your phone. Do not start reading messages. Do not look at the news. Bright light and phone screens can tell the brain it is morning. Then you may return to bed with a tired body, but an awake mind. After you use the bathroom, go back to bed calmly. Try slow breathing. Breathe in gently through your nose, then breathe out longer than you breathe in. This can help the nervous system settle. If worry starts, remind yourself, I am safe. It is still night. I can rest. Now, before we put this together into a simple plan, you need to know when waking up to pee is not just a home habit problem. Call your doctor if this is new, sudden, or getting worse. Call if you have burning, fever, chills, blood in the urine, pain in the side or back, new leaking, trouble starting urine, or a weak stream that is getting worse. Get urgent help if you cannot urinate at all, if you have chest pain, severe shortness of breath, confusion, sudden weakness on one side, or sudden severe swelling. These are not things to wait on. Also pay attention to snoring and breathing at night. Some people wake up to pee because sleep apnea is disturbing their sleep. Sleep apnea means breathing stops and starts during sleep. You may snore loudly, wake up choking, feel tired in the morning, or feel sleepy during the day. If that sounds like you, tell your doctor. Treating sleep problems can sometimes reduce nighttime bathroom trips. Now let's make this practical. Tonight, do not try to change your whole life. Start with a simple evening routine. Earlier in the day, drink enough water so you are not trying to catch up at night. About 3 hours before bed, have your last full drink. After that, use small sips. At dinner, choose a lower salt meal. Skip the salty snacks after dinner. If you usually have tea, coffee, cola, or alcohol in the evening, try replacing it for 7 nights with a caffeine-free, non-alcoholic drink earlier in the evening, not right before bed. After dinner, avoid sitting frozen in a chair for the whole evening. Get up gently if you are safe to do so. Walk around the room for a minute or two. Move your ankles while seated. Then, about an hour before bed, elevate your legs for 20 minutes. Let your calves help move fluid back before you lie down. About 20 to 30 minutes before sleep, use the bathroom once. Then finish your normal bedtime routine. Right before getting into bed, use the bathroom again. Keep it calm, do not force. Then make sure your path is safe, your nightlight is on, and anything you need is close by. Try this for 7 nights. Keep a simple note on paper. Write down your bedtime, how many times you woke up to pee, whether your ankles were swollen, and what you drank after dinner. This little record can be very helpful. It shows patterns. It also gives your doctor better information if you need help. Many seniors think they must accept broken sleep forever. That is not always true. Sometimes, small changes in timing, salt, leg fluid, bathroom habits, medicine timing, and sleep safety can make a real difference. Maybe you do not go from 4 trips to 0, but even going from 4 to 2 can mean longer sleep, better energy, and fewer risky walks in the dark. Remember the main idea. Your bladder may be the alarm, but it may not be the whole fire. Evening fluids can fill it, caffeine and alcohol can irritate it, salt can make the body hold water, swollen legs can send fluid back into the bloodstream at night. An enlarged prostate, pelvic floor changes, medicines, blood sugar, infections, and sleep apnea can all play a role. The answer is not fear. The answer is to pay attention and make safe, steady changes. So tonight, choose just 2 habits to begin. Move your big drinks earlier and empty your bladder twice before bed. Tomorrow, add the lower salt dinner. Then add leg elevation. Let your body show you what helps. And please, do not ignore warning signs. Blood in the urine, fever, pain, sudden changes, severe thirst, sudden swelling, chest pain, or trouble breathing deserve medical help. Asking early is not weakness, it is wisdom. Now I want to ask you something. How many times do you usually wake up to pee at night? Once, twice, 3 times, or more? Write it in the comments, along with your age if you feel comfortable. Your comment may help another senior feel less alone. Subscribe to Dr. Wellness for more simple health habits for seniors in plain English. And in the next video, we'll talk about another common evening mistake many people over 60 make without realizing it.